You might think it would be obvious if you had high blood sugar, but it's actually entirely possible for signs of high blood sugar to fly under the radar. There are a lot of people who don't realize they have high blood sugar. So, if this is the case with you, you certainly aren't alone. Today, we'll tell you 10 alarming signs your blood sugar is too high. Number 10. Fatigue. Feeling tired may be the most common early sign of high blood sugar, Dr. Hadipoglu says. It's also one that can occur in a mild degree, with even the mild and normal blood sugar fluctuations that happen in people without diabetes or with pre-diabetes when they consume a large amount of simple carbs like sugar, she says. Of course, tiredness is a pretty non-specific symptom and can even be a sign of low blood sugar, as Dr. Adimulum points out. If you notice fatigue regularly occurring right after you eat, though, especially a carb-heavy meal, it may have to do with rising blood sugar levels. People will say, "I want to nap after lunch," or "I just cannot open my eyelids after dinner," often after eating something like a lot of pasta or potatoes or sweets, Dr. Hadipoglu says. To be clear, there's nothing wrong with eating these foods, but if you notice that they always affect you in a very specific way that you find troubling, like always making you incredibly sleepy, it's a sign you may want to talk to a medical professional. Number 9. Frequent urination. When you have too much sugar in your blood, your kidneys start trying to pour out more sugar to get rid of it. And as they excrete the sugar, they pull out water with it, Dr. Hadipoglu explains. This makes you have to visit the bathroom more than usual. This is a common but not so obvious sign of blood sugar that is too high. Feeling really thirsty and needing to drink more usual. Excessive urination, known as polyuria, occurs when glucose builds up in your blood and your kidneys begin working harder to get rid of the extra glucose. If your kidneys can't keep up and adjust blood sugar so that it returns to a normal level, the excess sugar is flushed out of your body through urine, she adds. You may become dehydrated and get dizzy. Number 8. Increased thirst. This is a natural effect of peeing more, Dr. Adimulum explains, because your body becomes dehydrated. People start feeling thirsty all the time, Dr. Hadipoglu says. The dehydration also becomes clinical. The Mayo Clinic explains, the more you pee, the thirstier you are. The more you drink, the more you pee, and so on. Number 7. Headaches. Dehydration from any cause can trigger headaches, Dr. Hadipoglu says. Of course, headaches can be a sign of many different things, but it's worth getting checked out if it's something new or coupled with other symptoms here. The dehydration can also worsen your fatigue in addition to your headaches, by the way. Hyperglycemia is a condition caused by having a blood sugar level that is too high. This happens when your body is unable to break down glucose efficiently with insulin. Your blood sugar may rise above 180 to 200 milligrams per deciliter. Experiencing a headache may be an early sign of blood sugar that is too high. Headaches associated with hyperglycemia may start out mild in nature and get worse as your blood sugar rises or maintains a high level. Eating a lot of sugar in a short amount of time may cause rapid changes to your blood glucose levels. That can lead to symptoms that some people describe as a sugar hangover, including headaches, nausea, or upset stomach, difficulty focusing, shakiness, tiredness, or lightheadedness, mood swings. Number 6. Blurred vision. When there is excess sugar in the blood, it can affect some unexpected areas in the body, like your eyes, according to the Cleveland Clinic. Essentially, extra sugar, along with a little water, gets trapped in the lenses in the middle of the eye, causing a blurred effect, Dr. Hadipoglu explains. This is temporary and not the same as the damage to the eye that can occur in the long term with a condition like diabetes. Number 5. Nausea, vomiting, confusion, and more. These seemingly desperate symptoms are all signs of a rare and life-threatening state called diabetic ketoacidosis, DKA, according to the U.S. National Library of Medicine. DKA can cause the symptoms above, as well as stomach pain, trouble breathing, dry or flushed skin, fruity smelling breath, or difficulty paying attention. It usually occurs in people with type 1 diabetes and is sometimes the first sign they are sick. Number 4. Recurrent infections. Consistent hyperglycemia can weaken the body's immune response, according to the CDC. This makes it harder for your body to fight off some infections, making them more frequent, lingering, or serious. Dr. Hattie Poglu especially tends to see frequent yeast infections in people with vaginas who have diabetes. This is because excess sugar from high blood sugar spilling out through the urine helps feed the bacteria that can cause these infections, the NIDDK says. Diabetes can also make you more prone to UTIs, according to the CDC. Number 3. Slow healing sores. High blood sugar levels can affect your body's circulatory system as well, Dr. Hattie Poglu says, impairing blood flow and the body's ability to heal itself. Sores that take a while to heal, often on the feet, are a common sign of this decreased circulation. Minor wounds, cuts, and burns are an unfortunate but unavoidable part of life. Cuts or injuries on the feet or legs can make walking difficult or exercise painful. It is essential that people who have diabetes keep their blood sugar levels under control to reduce the risk of slow healing wounds and complications, including foot ulcers. According to some reports, foot ulcers will develop in about 1 in 4 people with diabetes. Foot ulcers are painful sores that can ultimately lead to foot amputation. Number 2. Dental issues. Glucose is present in our saliva as well as our blood. When there's too much of it, it helps harmful bacteria in your mouth grow and combine with food particles to create plaque, the NIDDK explains. This leads to issues like tooth decay, cavities, gingivitis, gum disease, and bad breath. In fact, 1 in 5 cases of total tooth loss is linked to diabetes. The good news is you can take charge of your health today. Controlling your blood sugar, brushing, flossing, and visiting your dentist regularly can go a long way to help decrease the likelihood of developing these diabetes-related mouth issues. Number 1. Tingling hands and feet. Over the years, hyperglycemia can begin to impact nerve function and eventually cause nerve damage, called neuropathy, Dr. Hattie Poglu says. The most common kind of neuropathy is peripheral, according to the NIDDK, which affects the extremities. You might start noticing feelings of tingling, numbness, or burning in your hands, feet, arms, and legs, per the Mayo Clinic. Nerve damage usually starts in your hands and feet, but it can also affect your stomach, bowels, bladder, genitals, heart, and other parts of your body. See your doctor right away if you get tingling, pain, or numbness in your hands or feet, stomach problems like nausea, vomiting, or diarrhea, a lot of bladder infections or trouble emptying your bladder, problems getting or keeping an erection, dizzy or lightheadedness. If you have nerve damage, you can improve or slow its progress if you keep your blood sugar levels near normal. Some supplements and medications for pain, nausea, or sexual problems can also help. If you are experiencing any of these symptoms, get your sugar level checked. Please subscribe to the Health Awareness. Thanks for watching.